the world has shifted so much and things are so different than they were even just a few months ago. Because of the COVID-19 pandemic, our families are being asked to stay in their homes for extended periods of time, and in many instances, schools are being closed for the rest of the school year. And when you have children, especially young children, this can all be an especially nerve-wracking time. So we wanted to go over a few basic things to help manage the stress and anxiety of the situation and to help you stay home with your kids and be happy and healthy.
Why is it important to maintain a routine?
So that's a really great question. Really, routines are important for children of all ages, but especially young children. And they really thrive on routines. It helps them know what to expect throughout the day so that there aren't any surprises and that they can really have that sense of, this is how my day is going to go. Now, for people who have children who are now out of school, your routine doesn't have to mimic what was happening when they were in school. So, for example, if your children are waking up at 6 a.m. to catch the bus, you don't have to keep waking them up at 6 a.m. They can sleep in a little bit. But it's still reasonable to wake them up at, an early enough time, 8, 9 o'clock, and then proceed with your routine through the rest of the day. The structure really helps your little ones know what to expect. And because of that, it can decrease tantrums and frustration, not just for the children, but for the whole family.
How do you talk to your children about their feelings?
So it's really important to talk to our children about their feelings because that same sense of nervousness and anxiety that we're feeling as adults, it's probably happening for your children as well. Now, they may not have necessarily the correct words to really say what they're saying verbally. But if you think about it, their lives have shifted a dramatic amount too. All of a sudden, they've gone from going to school every day and seeing their friends to just kind of being at home with their family all day. It's a big adjustment. They can't ride their bikes to the park or down to the store. They can't even have regular outings with their families, like going to the movies or going out to dinner on a Friday night. And so all of these changes can be really distressing for children, and they may not even understand why it's happening, especially for something such as COVID-19 that can be honestly really difficult to explain to young children. So because of that, young kids can start to act out or even start doing things like bedwetting again. This can actually be a normal process, even though it can be a little bit frustrating. So I personally recommend having daily check-ins with your child. Ask them how they're feeling and give them an opportunity to answer. Sometimes for younger kids, it may help to provide an example. For example, I feel sad or mad or frustrated or happy. And also, it's important for parents to know that during this time, it's really common that emotions can switch from day to day. So the children who may have been excited that there's no school can all of a sudden have a big change of heart when they miss their friends or their teachers, which is also perfectly normal.
What are some ways to create a safe space for kids to talk about their feelings?
So one way to create a safe space for children to be able to openly express their feelings is for the adults in their life to be as open with their own feelings. Now, make sure that it's age appropriate, but it's perfectly okay to tell your own children if you're feeling nervous or mad. It's a great example to show them how to experience emotions in a healthy way. As long as you're reassuring them that you're having these feelings together and you're going to experience this together and that everything is probably going to be okay. There are ways to even uplift their moods a little bit. Now, with social distancing, it's hard to have, normal play dates or go to the park or go to the zoo, but you can do things like virtual play dates. There are lots of apps and um, technological devices with tablets and phones where children can still see their friends, or you can even go for a drive. Going for a drive in your own car is perfectly acceptable as long as you're not getting out.
Why is it a good idea to limit news exposure?
Because of the 24-hour news era that we're living in, there's a fine line where being informed turns into information overload. There's actually some evidence that chronic exposure to news can be linked to higher feelings of anxiety and fear. So it's perfectly okay and actually encouraged to take breaks from watching or reading or listening to news. Now, this can be news on the television, on the radio, social media. All of these things count as exposure. And hearing about the pandemic repeatedly over long periods of time can also just be upsetting. Now, I would also be cautious for younger children to pay attention to what's playing in the background. If you have news on the TV and you think that they aren't listening, chances are they probably are. So I would consider limiting your news consumption to about an hour a day. Um, for adults, if you want to wait until after your children have gone to bed, or if they're napping, or if they're otherwise occupied, that can be a great way to limit their exposure as well.
You say when doing schoolwork at home, give yourself some grace. Why do you say that?
So I think it's really important for parents to be able to give themselves some grace during this difficult time because often parents are not teachers. So hats off and a big salute to our educators and teachers. You are invaluable leaders in our community and are greatly appreciated. At the same time, our teachers and educators are specially trained to teach students every day and multiple students at that. Most parents don't get that same training, and that's perfectly okay. So I think it's completely fair and reasonable to build a time for schoolwork into the schedule that we were talking about. Consider maybe 2, 3, sometimes 4 hours a day for older children, but this can help parents tackle the teaching goals into smaller sessions. And it can also be really beneficial for parents who are working from home because everyone is working on their respective work at the same time. And they're essentially conducting class. Another good tip is that if you have a child with special educational needs, it's a good idea to be in touch with either their school counselor or their teacher and try to send them a message and see if there's any tips they've been using in the classroom. A lot of times they'll provide you a lot of information for ways to be able to motivate your child when you're teaching at home. And something else is that once traditional schoolwork is complete, it's a good idea to think about something like extended learning, where you can explore your neighborhood or your backyard, ask children to identify different plants in the neighborhood, or even something as simple as having them help you in the kitchen to make a meal. Older children who are of reading level can read off recipes and help say how much of something should go into a recipe to make a whole meal. And it helps them feel really proud that they helped create something with their parents.
How can legacy help parents better manage their children's anxiety and stress?
So your legacy doctors and providers know that this is a very difficult time for a lot of families, even our own families. And your providers have not forgotten about you. We're still here and able to assist any needs that you're having. We're actually offering telemedicine services, so you can still see your provider from the comfort of your living room. Now, in this new capacity, we can discuss things such as managing anxiety or stress, or other things that come up like colds, rashes, medication refills, weight issue, or even behavior concerns. Now, it is important to know that if you notice that you or your child seems more withdrawn or depressed than typical, and you feel like you're really having a difficult time, please reach out to us at Legacy Community Health and consider discussing your behavior or the concerns with your provider. We're also having telemedicine visits with our behavioral health team as well. So therapists and psychiatrists are available to assist you. Also, to protect our patient and staff, we're asking families to consider the telehealth visit as a great option to traditional walk-in visits. It helps us limit the foot traffic in our clinic and the exposure to people who may be infected. Now, if you're not sure what the best option is for you and your family, please go ahead and give us a call. We have triage nurses to be able to assist you and figure out what the best way to get care for you and your child is.